All right, today we're tackling a big one, the prostate. It's this small gland that, believe it or not, sparks huge debates. We're going to get into exactly why a seemingly simple screening test for a really common cancer is one of the most controversial topics in all of modern medicine. This tiny walnut sized gland brings up some enormous questions, and it really gets at this central paradox in medicine today. We've gotten so good at finding potential problems, but our ability to find them is often way ahead of our wisdom about what to actually do about them. So let's really dig into why the decision to screen is so far from a simple yes or no. Okay, first up, let's just get the basics down. What is the prostate, and what are the main things that can go wrong? Because understanding this stuff is frankly the foundation for making any kind of smart decision down the line. So, where is this thing? Well, the prostate sits right there, below the bladder. It's a small but mighty gland that plays a key role in the reproductive system. It makes some of the fluid in semen, but its location is also key to understanding the problems. When it gets bigger, it can cause all sorts of issues with urination. Now, this is super important. The vast majority of issues people have with their prostate, they are not cancer. It is absolutely vital to separate the most common problem, which is just a simple enlargement, from the one that everyone fears, cancer. Okay, so let's break this down. On one hand, you have benign prostatic hyperplasia, or BPH. It's a non-cancerous enlargement. The best way to think about it is like a kink in a garden hose that's squeezing the tube and making it hard for things to flow. This gets incredibly common as men get older. On the other hand, you have prostate cancer. That's a totally different beast, an uncontrolled growth of abnormal cells. Just knowing the difference between these two is the first huge step toward making smarter and, frankly, less anxious health choices. And that brings us right to the heart of the matter, this intense, long-running debate over screening with something called the PSA blood test. This isn't settled science, not by a long shot. It's a field just full of trade-offs. This quote from the U.S. Preventative Services Task Force says it all. The top guidance body in the country doesn't give a clear yes or no. Instead, they basically say, look, this has to be your call. And that's because the right answer is totally wrapped up in a really complicated trade-off between the potential benefits and the potential harms. So let's talk about the benefit side of that trade-off. Here's the number. If you screen 1,000 men in that key age range, you might prevent about 1.3 deaths from prostate cancer. Now, that might not sound like a huge number, but you have to remember, if you're one of those 1.3 people, well, it's everything, right? This small but very real potential benefit is what keeps the argument for screening going. But, and this is a huge but, that benefit comes at a cost. More than 15% of guys might get a false positive result, which leads to a ton of stress and more invasive tests like biopsies. Then there's this huge issue called overdiagnosis. That's when we find these slow-growing cancers that would never have actually caused any harm. That could be up to half of all cases found through screening. And treating those can lead to serious, life-altering complications, like incontinence and erectile dysfunction. That's the really heavy price that a lot of men will pay for that small chance of benefit. And this whole idea of weighing personal trade-offs, it's not just for cancer screening. It applies directly to treating that much more common condition we talked about, BPH. Just take a look at this. When you're treating BPH, your options are all over the map. You have minimally invasive procedures like UroLift, which has basically a 0% risk of causing erectile dysfunction. But then you have more intensive surgeries where the risk of other side effects like dry ejaculation can jump up to 45%. So you have to ask yourself, what matters more to you? Is it maximum symptom relief, or is it preserving sexual function? The best choice is totally personal. And just when you think you've got a handle on it, it turns out that even our best efforts at prevention can backfire in really unexpected ways. This is something we see in medicine all the time, the law of unintended consequences. This story is just wild. There was a massive study called the SELECT trial, and it was designed to see if vitamin E could help prevent prostate cancer. But the result was a complete shocker. The men who took a daily dose of vitamin E actually had a 17% higher risk of getting the disease. It's just a powerful reminder that even natural stuff can have really potent biological effects. Now, all this complexity also shines a really bright light on some crucial gaps in our healthcare system, especially when it comes to communities that are often marginalized. So here's the thing. Transgender women, even when they're on gender-affirming hormone therapy, still have their prostate, and that means they are still at risk for prostate cancer. But the data shows they get screened at much lower rates than cisgender men. And this creates a really dangerous paradox. You have lower screening rates, but at the same time, a higher chance of being diagnosed at a late, much more dangerous stage of the disease.
And this chart right here, it shows you exactly what we're talking about. You can see the gap in screening rates plain as day. And this isn't just a statistic, it's a major health disparity that points to a really urgent need for more inclusive and evidence-based health policies for the entire transgender community.
So, where does all this leave us? After looking at the data, the screening dilemmas, the treatment trade-offs, what's the big takeaway? Well, it's that navigating your prostate health isn't about finding one single right answer. It's about having the right conversation.
So here's your game plan, a way to take control. Step 1, know the basics, everything we just covered. Step 2, really think about those trade-offs. What risks are you okay with for what potential benefit? What matters most to you? And step 3, the most important one. Take that knowledge and have a real, in-depth conversation with your doctor. That's what turns you from being a passive patient into an active partner in your own healthcare. So we'll leave you with this question. After seeing all the data, the complex trade-offs, and what's personally at stake, what does an informed health decision actually look like for you? Because our goal here isn't to give you the answer, it's to make sure you know the right questions to ask.